I think what I enjoy most about Children's Mercy is just the emphasis on the kids. That is the pure focus. There are people working in labs trying to make discoveries that I'm going to be able to use hopefully in my patient care. And then there are those of us taking care of patients, and we all work together with their emphasis on kids. My name is Allyson Hayes, and I'm a pediatric oncologist in the Division of Hematology Oncology here at Children's Mercy. Oncology is treatment of cancer. And so I treat cancer in kids. One of the most common forms is leukemia, which is a blood cancer. And then I also treat some solid tumors like Ewing sarcoma, rhabdomyosarcoma, osteosarcoma. And then in addition to that, I have a special interest in histiocytosis. And that's a group of rare diseases that can show up as anything from a skin rash to involving every organ system and be life-threatening. I treat kids who are newly diagnosed with cancer, so developing a treatment plan for them that not only works for the patient, but also for the entire family. And then I also see patients that are off therapy, so they've completed therapy, maybe they're moving from another part of the country to, our area. And so I see patients both on therapy and off therapy. I think that we do a great job at individualized treatment plans. So tailoring the treatment for not only the size of the patient, that's standard, but also trying to meet them where they are. Pediatric oncology is really filled with hope. Our overall survival is over 80%. I love the fact that when I ask a parent to do something for their child, 99.9% of the time, they will bend over backwards to do whatever it is. These families are amazing. They are facing challenges I can't even understand. The challenges to their daily life and the threat to their child's life. And so many times they teach me so much every day. There are a lot of exciting things happening within pediatric oncology. We have more treatments available now than we ever had. So many times we have wonderful outcomes and, kids go into remission and they're long-term survivors. I've been invited to patients' graduations and weddings and all kinds of different things. Some of my patients have gone on to be nurses. I am absolutely on a daily basis inspired by these families.